This video we're talking about contact dermatitis. Contact dermatitis, it's one of the most common causes of a rash. So if you have a rash, or if someone you know has a rash, or if a patient has a rash, just start with the lowest hanging fruit, which would be contact dermatitis. And there's two types of contact dermatitis. You have irritant, which is 80% of the time, and you have allergic, which is 20% of the time. We're going to compare and contrast them a little bit. So with irritant, everybody's susceptible to this, and you do not have to be sensitized. So the first time you touch this particular irritant, it can cause a rash. It's immediate, so even seconds to minutes. And even though it's immediate, sometimes people have trouble figuring out what it is, because it might be something they feel like they've been in contact with before. So maybe they're washing their hands with soap a little more than they usually do, and just that increased exposure to the soap that normally doesn't cause any problems can cause a rash. So you really have to kind of dig in with people and help them try to figure out what the underlying cause is. It could be chemical or physical. It could be something like photosensitivity, or where sunlight causes it, or like a wool sweater, or perfumes. So like I said, soapy water, household cleaners, rubbing alcohol, detergents, like using a new laundry detergent, bleach, shampoos, fertilizers, pesticides. I may have said something twice, but there's just so many different things. You just really have to dig in with people and just see what anything that they've come into contact with. Maybe the yard just got sprayed with some kind of herbicide or something, pesticide, and then the kids go out there and play and roll around in it, and you may not even realize the person came and sprayed. You just really got to figure these things out and help them think through it. With allergic, it can be even more difficult to figure out what the underlying cause is, because it's delayed. It could be 1 to 3 days before the rash comes up, and you might forget about walking in the woods and just something coming across your leg, poison sumac, ivy, oak. These kind of things take a little time for it to develop. With these, you have to get sensitized first. So you have to be exposed to this particular allergen before. This is a type 4 hypersensitivity reaction, so it involves the adaptive immune system, in particular the T lymphocytes. So the helper T cells, they are involved in this, and so those lymphocytes have to see something first before they can mount a response to them. So other common causes of the delayed allergic type contact dermatitis are nickel, which is in a lot of like jewelry, belt buckles, zippers. You just got to look at the area too, because the area that's exposed on all this stuff is where the rash is going to be. So that helps you kind of clue in, what did this particular part of my body touch? If you see a rash that kind of goes across here, maybe 3 days ago they wore a different necklace, like costume jewelry or something that had nickel in it. Latex, cosmetics, makeups. When it's been 3 days and you may have tried a different makeup, it may kind of slip your mind. So just kind of work through this with people, because a lot of times that is the cause, some kind of underlying cause. And if you can't figure it out and it seems to be this allergic type, you can actually have a patch test done at an allergist, where they put these little patches on your back, and you come back a few days later, give it time for that delayed response. And if you have a lot of redness and kind of response inflammation, then they know these might be some targets. So it may be food or grass, or just something that you've never thought about. But as far as treatment, the big thing is removing the agent. If you keep exposing yourself to this agent, the rash is going to return over and over. So that's the main thing. But as far as symptomatic relief, when the rash is there, you can do like a cold compress, where you just put like a cold wash rag on your skin and just let it sit there for like 15 or 20 minutes, just kind of to soothe it. You could put aqua vera on it or something like that, just some kind of cooling agent. Topical steroids is good, especially with it being with the T lymphocytes. So like hydrocortisone cream, something like that would be good. If it gets more severe, you could go up to like an oral steroid, but I would try to avoid that if possible. Antihistamines, if you have a lot of pruritus and itching, those work really well for that. So if it's during the day, you'd want to take something that wouldn't make you drowsy, like Claritin or Allegra or something like that. But at night, you may want that little boost to get to sleep. So not really a boost, but you want something to help you get to sleep. So diphenhydramine, which is Benadryl, that's a good antihistamine at night if you have a lot of itching. So that's kind of the low-hanging fruit. A lot of times the most common causes of a skin rash. There's some other ones, you could have eczema, which has more of a genetic component. A lot of times it shows up before the child is 2. And with eczema, or it's also called atopic dermatitis, a lot of times it shows up in creases, like the elbow creases, and kind of have a plaquey appearance. Maybe the creases in the neck or behind the knee. It's common places that you see eczema or atopic dermatitis. A lot of times a parent may have it. And another one is on the face. So if someone comes in and they have redness across their face, there's, if they have lupus or have family, you might ask if anyone in their family has lupus, because that may be the first time that they notice they have that discoid rash, called the butterfly rash across the bridge of the nose and cheeks. Also, you can kind of get that area and on into the eyebrows with seborrheic dermatitis, which is a pretty common fungal infection of the skin, and it causes a lot of scaling. So you'll see the little flakes, over the skin and in the eyebrow and stuff like that. So that's pretty common as far as skin rashes too. So just think about the location with the contact dermatitis, because wherever the contact is, that's where it's going to be. Whereas eczema and that kind of thing, it's more like on both sides of the body. There hasn't been anything in contact with it typically. So I hope that helps. And next time you have a rash, you have at least kind of a little bit of a systematic approach to approach it with.